Physics Concept Presentation by Aubrey Foreman. What is ultrasound imaging? Ultrasound imaging is a non-invasive technique that uses a transducer that produces a high-intensity sound wave in order to get real-time imaging of the structures within your body. Then these images are displayed on the screen. How does ultrasound imaging work? The main part of ultrasound machine is the transducer, which sends and receives ultrasound waves that are transmitted into the body. The transducer contains tiny crystals called PZT crystals. When electrical currents are sent through these crystals in the transducer, they begin to vibrate in order to create sound waves that transmit into the body. These sound waves hit different structures, causing sound waves to be reflected back towards the transducer. From here, the sound waves are then received by the PZT crystals, transforming the sound waves back to electric currents that are sent to the scan converter. The scan converter then takes electrical signals that are being sent from the transducer and displays it as a two-dimensional grayscale image on the monitor. Three types of transducers: linear, convex, and phased array transducers / cardiac. Linear transducers. One of the most common transducers that you'll see being used in ultrasound imaging is called linear transducer. With this transducer, the PZT crystals that we talked about before are arranged in a straight line to generate or receive ultrasound waves. Because of the linear transducer PZT crystals are positioned, they make a rectangle or square shaped image on the screen. Frequency 3 to 12 megahertz, depth maximum 28, minimum 1.5. Linear transducer presets: lower and upper extremity veins and arteries, adult and PED abdominal, ultrasound, testicles, breast, thyroid, and then MSK. This type of transducer is ideal for scanning superficial vessels like blood vessels, thyroid, tendon, and muscle. Convex transducers. These transducers have a boat or curve-shaped end with PZT crystals that are arranged side by side in this curved or bow-shaped pattern. Because of the pattern of the PZT crystals, they form a blunted sector-shaped image on the monitor. Frequency 1 to 6 megahertz, depth maximum 40, minimum 4. Presets: adult and PED abdominal kidney, GYN, OB fetal echo, fetal cardiac, fetal echo pen, and etc. This type of transducer is mainly used for abdominal scans. Phased array transducer is a compact and has a very small footprint. There are as many as 100 to 300 PZT crystals that are placed compactly side by side, with each element being rectangle and narrow. All these elements in the transducer fire all at once to create an image. This image creates a transducer as a fan or a sector-shaped image. Frequency 1 to 5 megahertz, maximum 38, minimum 2. Presets: adult and PED cardiac, cardiac difficult, adult ABD difficult, and it's used mostly for cardiac examinations. Methods of recording data. You got 2D imaging, 3D/4D imaging, and cine loops. In clinical sites today, they use 2D imaging in order to get diagnostic images that display slices of anatomy on the image. How is this done? The transducer sends multiple sound pulses in different directions and receives the information. The information is then sent to the ultrasound system, which takes all the data to create a 2D image that we see today. So this is an example of a 2D image right here. And the anatomy is of an internal jugular vein. 3D imaging. We take several 2D images at different angles around the structure of interest. Then all of these 2D images are then processed by high-speed computing software that will take these 2D images and produce a 3D image. 4D is just like 3D image, except for it allows us to see the motion and movement of structures of interest. This is an example of 3 to 4D imaging right here. Cine loops. This is an ability to let the sonographer take several 2D images in a certain period of time and making it into a short video of the structure. So right here is an example of a cine loop of the parasternal long axis of the heart. It's taking those 2D dimensional images and turning into a little video. Pre and post processing. Pre-processing is a manipulation of data before the data is stored in the scan converter. This is everything that can be done to an image before the image is stored in the scan converter, or frozen is another word for it. The goal of pre-processing is optimize the image the best you can. So you want to get it the best looking you can. Post-processing, basically, it's when the image is frozen. It's everything that can be done to the image after it's frozen, and what you want to do is use like your gain or TGCs to improve image quality. Depth. Depth is one of the most fundamental settings on the ultrasound exam. When you adjust the depths, you're telling your transducer how far to shoot the waves inside the body. This is an ultrasound image with too much depth. The issue with having too much depth is you're pulling away from the structure of interest by adding more to the image than is needed, which will reduce your frame rate, which will reduce your temporal resolution and your image quality. So this is ultrasound image has too little depth, which is cutting off some of the PTVs, so you don't get all the information needed. And this is the perfect amount of depth. You're too deep, which is reducing your image quality, but you're not too shallow, which you're still able to see all the structure. Gain is another fundamental control setting in the ultrasound examination. Adjusting gain lets you brighten or darken the real-time ultrasound image. A zoom knob on a too dark or too light of an image helps you see small differences in the image. So here in this image of the PTVs, you got too much gain, which is making the image look washed out right here. In this one, you got too little gain, so you can barely distinguishes the difference in the tissue. And then in this one, your gain is perfect. You can see how clear, you can see the tissue, the differences in them, and then you can also have a clear lumen inside the vessel. Time gain compensation. In this image, you have your TGCs. These are buttons on your ultrasound machine that allows you to adjust for the change of attenuation at different depths. The TGCs allow you to adjust the signal strength horizontally across the image from top to bottom. This allows the sonographer to have a smooth and clear transition of the tissue at different depths. In this image, the dark portion right here is considered your near field. This is the top of the TGCs button. Down here, this white portion is considered the far field. So this is the bottom portion of your TGCs button. And you can see how it adjusts the gain horizontally. So the focal zone is in between the near and far field of your TGCs. This is an area with the highest intensity of the sound wave. So this can be the area you get your best image quality. You can see right here, your focus is on the structure of interest, so it's real clear. Right here it's not, so the images are very clear. Right zoom. The first type of zoom we are going to talk about is called right zoom. Right zoom is a pre-processing type of zoom, which happens when the ultrasound machine has a live image. Right zoom rewrites the pixels data that is already existing, which this will lead to less blurriness resolution of the image. In this image of the posterior tibial vein, we are using right zoom. Read zoom is a post-processing technique. When you hit zoom on a frozen image, it uses the same image that was stored and increases the size of region of interest, which causes blurriness or decreases the image quality. Sector range. Sector range is changeable by the sonographer. So here you got a wide sector and you got a narrow sector. Well, when you have a more narrow sector, your frame rate will increase, which will increase your image quality, rather than having a wide sector, which would decrease your image quality. So your dynamic range. Another console setting that the sonographer has the ability to change is the dynamic range. When you have a low dynamic range, which is right here, this will make your image look more contrasty. But when you have a higher dynamic range like this, there'll be more shades of gray and a better transition. So you won't be as contrasty. It'll be a softer and smoother image. Frequency. Frequency is number of cycles that occur per second. When you have a higher frequency, you don't penetrate, so you don't go as far in the surface and into the body. You're more superficial. When the farther you go, when you have a lower frequency, you go into the farther into the body, but it's so in this one, but sacrifices image quality the farther you go into the body because of attenuation. Invert image. This is a button on the machine that allows the orientation of the image to be flipped. When you turn this on, it flips the image from its original position. So right here, this M tells you the original position, and as you can see, the structures got inverted or flipped by the movement of the M, you can tell. Auto optimize. This feature is exactly what it sounds like. It automatically optimizes the overall gain and contrast of the image. This feature examines the tissue of the image and looks for the most optimal settings to get the best image. Like in this image. M-mode. M-mode is known as a motion mode ultrasound. This is a type of ultrasound image that lets the sonographer display the movement of structures over a period of time. M-mode is a one-dimensional image technique that shows a single slice of the structure along its scan line. So this is of the heart. You can see it just shows a period of time of everything. Color Doppler. Color Doppler is a technique that allows the sonographer to visualize blood flow and the direction of the blood flow. So this is Color Doppler. The image to your right is a good example of Color Doppler. Pulse repetition frequency / scale. This setting allows you to adjust for high and low velocities of blood flow within a vessel. This is important because it allows the sonographer to get a proper solid color field within the vessel. Aliasing is where fast flow signals look like they are moving in opposite directions than they actually are, causing an image to have multiple different shades of color filling the vessel rather than one solid color. And this example of a pulse repetition frequency. So you got your scale, it's correct. When your scale is correct, then you'll have solid color field, but here the scale is wrong, so it creates this change in color, this aliasing. Color Doppler gain and area of interest box. The gain is another setting that you can adjust by turning the knob of the machine. The control allows you to increase or decrease the number of Doppler signals that is displayed in the color box. When you have gain too high, this can cause color bleed within the vessel. So right here, your gain's too high, it's called color bleed, but in this one right here, your gain's too low and it's not filling the vessel. And your color box is this little box right here. This is your area of interest box is this little box right here. Pulse Doppler. Pulse Doppler. Pulse Doppler is an ultrasound technique that allows the sonographer to see the direction and also speed of the blood flow within the vessels within the body. This is a good example. Pulse repetition frequency / scale. This allows you to adjust how big the velocities are so you do not pass the Nyquist limit. If you have your waves passing the Nyquist limit, you will have aliasing occur. So this right here, down here, is considered aliasing. See how it like wraps around the information? It's getting cut off and come back around. The way to avoid that is adjusting your frequency or scale like this one's adjusted correctly. Sample gate. This is a small area that the sonographer wants to take measurements, evaluate the velocity and movement of blood within the vessel. When the sample gate is too large, it picks up unneeded information and you don't get good velocities. So your sample gate is kind of hard to see, but right here within this vessel, you got a sample gate, which you get good velocities, but right here, your sample gate's super wide and you get unneeded information, you don't get good velocities. Pulse Doppler. So pulse Doppler is still angle correct. This is a method that allows sonographer to adjust for inclination angle. The inclination angle is between the transducer and the blood flow of the vessels. So right here is just this line that comes through. That's what the angle correct is. Changing the gain. So pulse Doppler gain, all the gain does for this is it just makes your your velocities right here brighter. So here you can't really see it, but here you can. The baseline, this is your baseline right here. This line represents an area of zero flow that separates the positive and negative Doppler shifts. So you can adjust your baseline to keep from aliasing. So if your baseline is on the right spot, as you can see, you got aliasing coming around. The wall filter. The wall filter is basically just like a giant eraser that comes right here and gets rid of those high and low echoes that pop up right here. So you see you got your wall filter low right here, but it's high. It looks like you just ran an eraser across the baseline. Resolution and frame rate. This is the time it takes for the ultrasound machine to create an ultrasound image. Temporal resolution is very dependent on frame rate. So the more work you have done, you gotta do. So like this, you're not doing as much work, but with this, you're doing more work, which is decreasing the frame rate, which decreases your temporal resolution, which decreases your image quality. So continue on with resolution and frame rates. You got spatial resolution. This is the ability for an ultrasound machine to be able to distinguish between structures that are closely spaced together. So they break down into two things. You got axial resolution, lateral resolution. Axial resolution. This is the resolution along an ultrasound beam. This can be improved with a shorter pulse length. So that means decreasing the depth. So like right here you got increased depth, you can't really tell the difference. But right here you got more of a better axial resolution. Lateral resolution, this is just moving your focus. Right here, your focus is up here, you can't really see the difference. But within your focus right here, you can distinguish the difference of the resolution. Hyperechoic. So this is a tissue that reflects a high amount of ultrasound waves back towards the probe. This is this bright area. Your hypoechoic is your less bright shades, which would be right here. This is tissue that appears darker than surrounding tissue and only reflects a small amount of sound waves to the probe. So that would be your hypoechoic. Your isoechoic, this is this shades of grays that are all similar. So this area would be your isoechoic, and your anechoic is this is an area of image that is black that does not send back any sound waves, which would be like right here. This would be areas of anechoic structures. Artifact, so your reverberation, this is the artifact that occurs when sound beam reflects back and forth between two parallel structures. So right here, it like bounces back and forth. That's reverberation. Shadowing, this is when you have a high attenuation structure that absorbs the sound waves, making it where sound waves do not reach behind the structure, forming a black shadow behind the structure. So this is shadowing. And then acoustic enhancement. This is when a sound wave hits an area with a low attenuation rate, like a fluid-filled structure, and the sound waves are then reflected back and it's brighter. So this would be acoustic enhancement. Is this brighter part coming down. Mechanical index. Mechanical index is related to mechanical biological effects. This is because mechanical index assesses the potential cavitation effects that could cause by the transducer. When you increase the mechanical index, this will increase the image quality. There is a trade-off though. When you do increase the mechanical index, you do not run into the risk of cavitation within the structure. The ability to change the mechanical index does help with contrast-enhanced ultrasound, which cardiovascular sonographers use to optimize the microbubble contrast and reduce the noise in tissue. So right here, your mechanical index images would be up here. So mechanical index 0.6, low, right here, mechanical index 1.4. Thermal index can also be related to biological effects. This is because thermal index is the measure of thermal bioeffects from the ultrasound machine on the tissue. Thermal index helps sonographers tell the difference between small Tell the difference between small differences in the image quality. This helps the sonographer perform contrast enhanced imaging without exposing the patient to harmful thermal bioeffects. So up here, you got your thermal. You can see right here the changes for your thermal index. They're up top. And then your output power. When you have too much output power, this can lead to an increase in mechanical and thermal bioeffects. When you do the increased output power through, though, it results in a brighter image, which can improve image quality. When lowering the output power, this allows the sonographer to visualize microbubbles and improve the signal to noise ratio. So right here, your output power 8P, you see how it's brighter. This one has 100% output power. This one is 19.1, it's darker. And this is my works cited page for the images and where I got all my information. If you have any questions, just reach out. Thank you.